like that music. I'm not going to complain about that. I can't complain. It's just what it is, right? Oh my gosh. Okay, everything sounded echoey right there. All right, we're going to learn about our health. I don't know how afraid you are of the word surgery, but hopefully we'll help you out with that a little bit right now. Lauren Debick always brings us some really great guests from Ocala Health, and today she has brought 3 great guests, and they are in the studio. Russ Harper, Amanda Williams, and Jeff Nasman are going to talk to us about what they do at Ocala Health and at Strive Rehabilitation. Looks like Jeff Nasman has a Strive shirt and works for Ocala Health. Are you both? Double? Okay, I'm sorry. There's no microphone turned on there, but I got that crazy music on. All right, hold on. Lauren, good morning, Lauren. How are you?
Yo.
There you are. Oh, my gosh. You think I just started doing this, right? You know what it is? I've got, a handicap. Now I think I hear you better. Now try it.
I'm doing well. How are you?
Good, Lauren. Thank you all for coming in.
Thanks for having us.
Surgery is the worst word we want to hear, isn't it? Yeah, no, not for you?
Hopefully not. No,
it means we're going to
get better.
You're going to cut into us. This is a dumb question, but Lauren will tell you I'm known for dumb questions. Is a haircut, is that a form of surgery? Yeah, no, follicle surgery.
Minor.
Follicle surgery. All right.
Same day procedure.
Well, good morning to everybody. I think we'll start with you, Jeff. You are the director of rehab services at Ocala Health, and you're wearing a Strive shirt.
I am. Yes, Strive provides all the PT, OT, and ST services for Ocala Health. So we're a contract service for them.
What does that mean? All those initials.
Well, physical therapy, occupational therapy, and speech therapy.
Okay.
So that's our rehab department, and we're there to help support the surgical services. So
that means what you do happens after surgery, or maybe to prevent surgery?
Well, typically post-operatively, yes, we see them for sure. In some cases, we see them pre-operatively as well in order to prepare them for surgery.
Oh, to prepare?
Sure. For like an orthopedic surgery, they might need to work on some strengthening of certain muscles, and so we do what we call prehab exercises before the surgery.
Really? How do you measure it? How do you know when you're ready, when you've exercised enough?
Well, typically with prehab, we're just doing some gentle exercises that aren't going to, aggravate the situation they're going to go in for surgery for. But if they have an opportunity to do those exercises beforehand, then post-operatively it makes our job a lot easier. They're already training those muscles to kind of work in the way that we want them to, because after the surgery, it's part of a retraining, so that just kind of gives you a step up or a head start on the whole process.
Gosh, I always feel when I hear this kinds of conversations that I want to listen to everything you say, because I want to get through it as quick as possible. I want to be back into the normal zone, if you know what I mean. Amanda, you work with outpatient, right?
Yes.
So that means that the folks who come to see you, they're not necessarily going to be locked in a bed for a week or whatever, right?
Some of them may.
Some of them may.
Everybody that comes from home, from the outside of the hospital, they will come through outpatient surgery to get ready. But if you are going home the same day, you will come back to our department so we can educate you the best way that we can to get you home safely.
Is the type of surgery varied, or is it like a limited margin of types?
We do a various amount of surgeries.
It could be anything. Heart surgery?
Yes, sir.
Yep.
So brain surgery? Those are the two biggies, right?
Yes. Yes.
And what else would be a small one? Elbow surgery or something?
Maybe a carpal tunnel.
Yep.
Carpal tunnel. Well, I was close when I said elbow, didn't I? But you wouldn't have outpatient for heart surgery. That would
No.
Those people stay in bed for a while, right?
But stents, though, you have outpatients for stents.
Yes. Yes, we do.
Okay. Russ, you are a surgical specialist at Ocala Health. What does that mean?
Tell you what that means, and thanks for having us. It's good to be here.
Thank you.
And what I do is I work with our surgeons in the community to make sure that they have the resources they need at the hospital. So kind of like a physician relations for surgery is my role. So I'm talking to their office managers as well as the surgeons within the hospital.
Oh, really?
Yeah, to make sure that they have a good experience at Ocala Regional and West Marion, as well as ultimately that the patients have a great experience.
Do you match the surgeons with the need?
With the need for the patient?
Yeah, do you find a patient who needs a certain type of surgery and you say, oh, I know the guy?
You know what? Most of the time they have probably a trusting relationship with their primary care provider, and they are probably matched that way, which is probably the best way that it can happen. But also, we do have a resource, and you may have heard about it before, consult a nurse. That does help match patients with surgeons to make sure, based on their insurance needs or based on the type of surgery they're needed, that type of thing. So there is a matching service in that way, but most of it comes from primary care providers and referrals.
When you talk about insurance needs, at that point it's too late, isn't it? I mean, don't we need the insurance before we get there?
Well, what I'm saying is, as far as what type they have, so and making sure they're matched with a surgeon that takes their insurance. So.
Okay, my gosh, we have to have a whole conversation about that one day.
Yeah.
When a doctor schedules a patient for surgery, what is the time frame for something like that outside of an immediate emergency?
So it probably depends, and I'll let Jeff and Amanda chime in too, but probably depends on the type of surgery. Jeff mentioned for an orthopedic procedure, for a hip or a knee, that may be scheduled out a ways, but it's also something that they can go ahead and prepare for that through doing exercise or things like that. If it's something that is the gallbladder, it'd be a lot shorter time frame. It may be something that they take care of emergently.
Oh, really? Okay. So do we, I mean, rehab with the knee, we can kind of visualize what that might be. Do we have rehab with our internal organs? I mean, do you drink a lot of juice or something? I don't know.
Well, sure, but the rehab for that post-operatively is typically just getting the patient up and moving. Post-operatively, as the anesthesia wears off, we want them to be breathing well, so the exercise helps them with that. Also, blood flow, we don't want them sitting in the bed. A lot of times we have an idea that post-operatively we might convalesce for a period of time in bed, but that's not the case anymore. In many of these surgeries, in fact, in orthopedic surgeries, we get them up the same day if we can. So they'll come out of surgery, and that evening or later that afternoon, we might get them up to a chair because that's good for their lungs, keeps the airflow going, and also good for their blood flow as well, circulation.
How was something like that discovered? Because I know you hear years ago that the patients are in the hospital, they're in the bed, the only people that can see them are the nurses and the staff, even the family was kept away from them. What was the turning point, do you think, in making patients get up?
Well, I think over the years in clinical practice, they saw that patients did better when they got up and they mobilized, and then they did some studies out there. There's multiple studies out there that indicate that early mobilization after surgery is
get up and move, huh?
Get them up and move them, yes.
And I'm guessing, Amanda, that your counterparts from, let's say, 40 years ago must have seen a lot more or a lot fewer outpatients for the same procedures that are now outpatient, right?
Absolutely. Absolutely true. There are people, and people will say that too, it's kind of a misconception because they'll probably maybe know somebody that had surgery years and years ago that they stayed in the hospital for, like maybe having your gallbladder removed.
Right,
Whereas now you can go home the same day. So you do see that. So education is key, asking questions, making sure that you have a good understanding of what to expect before surgery is kind of half the battle once you get there. It makes it run so much more smooth.
Right.
But the patient, you also have to convince the patients that once they have this outpatient surgery, there are some limitations, and that if they don't follow the doctor's orders, they're going to end up right back in the hospital.
Yes, and working with our physicians, we give them a really good discharge plan on their way out the door. And we include the family as the patient allows us to, and that way they have a best case scenario for when they leave the hospital.
Do you work with pregnant ladies as well, or is that not part of what you do?
Not generally.
Not generally, because they get up right away. Like the April the giraffe. Did you see the baby?
Yes.
just done. I mean, if giraffes thought like humans, they would have had this big long bed, and she would have been laying in it for a week, right?
Yes.
Get her up and moving. That's right.
How do you keep the family or the caretakers involved with the patient?
Throughout the process, you can always have family and or friends, caretakers with you all the way. So their first meeting us is actually at a pre-admission appointment. So when they come to that appointment, we're getting all their health information, we're giving them a lot of instructions, but you're more than welcome to bring somebody with you. That way you have two people listening in on what the plan is. They can follow through the entire time. When they come in the day of surgery, they come to our department. They are able to have one person in the room while we sort of get them ready to go, but once they're ready, then they're more than welcome also to bring anybody back. That day, too, they meet with the anesthesiologist. They're able to ask questions. They see their surgeon before surgery. So all of that they can ask whatever they need to and feel like they're very comfortable before going in.
Yeah.
And do the surgeons have their own anesthesiologists that they work with? Their own team, nurses and everything?
The hospital has a group that we work with. It's the same people and the same providers, and but no, it's one group that the hospital has that used to working with those surgeons. One thing I'd say something on the family real quick, because I think it's an important point that Amanda was making. One thing that we try to do as well is keep people on the day of surgery, keep them updated on where their loved one or their significant other is in the process. So as they're waiting in the waiting room, they know that, hey, they're in pre-op now.
That's
or they're
really
in
good
surgery.
point, yeah.
And even if they can't be there, we have a service called SurgiTrack, and it's a text that is sent to your phone. And it's obviously someone that you designate that you want to receive those texts, but it can tell them where they're at in the process. They're in recovery or they're in PACU.
And Russ, do you get a lot of this where somebody, maybe they're from another area of the country and they're not so sure they're going to trust the doctors? Do you have to do a lot of convincing before they send, an airplane ticket to their doctor in Connecticut or something like that?
As far as trusting our physicians here in this community?
Yeah.
No, because I tell you what, we have a great group of surgeons. We really do.
Oh, I know, but I don't know if they know that.
Yeah, we're blessed to have that, because I think you can look. I mean, even the orthopedic in the orthopedic area, I'll talk about. U.S. News and World Report. They put out rankings, and we're consistently there with orthopedics in Ocala. That's the awesome.
I wish we still had it. We had this big, thick book. It looked like a Manhattan phone book back when phone books were around, and it listed all the grades, and we had really good grades in Ocala.
Mm-hmm. Yep. So we're consistently ranked very well in health grades for spine surgery, orthopedic surgery, GYN surgery. So it's we do very well right here in Ocala. We have a great group of community surgeons. So.
And Dr. Nasman, once the surgeries are performed, have you found out throughout your practice that the rehabilitations needs of people from a few years ago have changed? Up to now, you do different types of rehabilitation now than before?
Well, yeah, it has evolved over time as we learn more. At one time, just to give an example, CPMs, continuous passive motion machines, were in vogue for surgery, total knee patients. Right after surgery, they'd put them in the CPM. Now
and they make a move.
Yeah, and it would move your knee for you. Mm-hmm. But now they've shown that it really doesn't make as much of a difference as we thought it did a year post-operatively, and they're better off just doing the exercise actively themselves and getting up out of bed actively. There are certain cases, but they're the exception rather than the rule where a CPM would be used. But that's one evolution of exercise, and just the fact that instead of being in the hospital for a week to do a total joint or to do some other type of surgery, the time is so reduced. I mean, we might have them for 1 to 2 days, and then they're out the door. In fact, some of our hips are leaving the same day.
And then do they continue physical therapy on their own at their home with a nurse or a therapist, or do they come to you to Strive?
There are several options. Post-operatively, we do instruct them in discharge exercises so that they're going to continue those. They may have a home health therapist come so they can receive that therapy right in their home. They may be discharged to a rehab, depending on what their circumstance is. Or most often is the case, they'll go to outpatient therapy. Typically, ideally, a couple days after the surgery, they're right in the office and doing that therapy.
I have to tell you, I'm stuck on the line. Some of our hips leave the same day. I picked just hips
Yeah, we have
walking out the door.
Like frog
All
legs,
right,
right?
let me take a little break. Lauren Debick is here. Lauren has invited some guests today. If you have any questions about surgery, that's the topic of the day. The number is 622-9622, and we'll be right back.
The very best in quality is Captain T's upholstery.
Is that couch cushion sinking lower every time you sit in it? Does your boat look better with the cover on? Has your car's interior seen its better days? Stop using a towel to cover up those rips in the golf cart. Isn't it about time you had it restored to better than new with a custom upholstery from Captain T? Captain T's upholstery has been right here in Ocala for nearly 20 years, so they know how to make your ride one of a kind. Whether you want to take that classic ride back to a factory look or put your favorite sports team front and center, Captain T's upholstery is who to call. 352-369-1810. That's 352-369-1810. Or stop by their location, 5030 South Pine Avenue in Ocala, just past the drive-in. And of course, don't forget to visit them on the web, CaptainTUpholstery.com.
The very best in quality is Captain T's upholstery.
Hey Dan, what'd you get me for Father's Day?
Well, let's see. I like ham, turkey, roast beef, and especially meat falling off the bone ribs.
Well, I'm not cooking.
Clearly, eating is more your forte. So what do you say we let Honey Baked Ham and Cafe do the cooking? They've got everything we both like.
What's the address? I'll go pick it up.
2709 Southwest 27th Avenue, right there behind Best Buy. As a matter of fact, they even cater, so I'll make this one step easier by calling 861-0011 right now.
Honey Baked Ham and Cafe in Ocala.
Tell them Dan sent you.
Tell them Joe sent you. Get 10% off. Hey Dan, what'd you get me for Father's Day?
Well, let's see. I like ham, turkey, roast beef, and especially meat falling off the bone ribs.
Well, I'm not cooking.
Clearly, eating is more your forte. So what do you say we let Honey Baked Ham and Cafe do the cooking? They've got everything we both like.
What's the address? I'll go pick it up.
2709 Southwest 27th Avenue, right there behind Best Buy. As a matter of fact, they even cater, so I'll make this one step easier by calling 861-0011 right now.
Honey Baked Ham and Cafe in Ocala.
Tell them Dan sent you.
Tell them Joe sent you. Get 10% off.
The commercial, so nice. We played it twice. All right, let's get back. The phone lines are open. Somebody had called in, and if you were waiting and didn't realize you were connected, go ahead and call right now. You'll hear me say hello. You're on the air. This is a great time to ask questions. Maybe surgery is something that you know is imminent in your future. Is that a good word, Rob? Imminent? Or maybe for somebody else. Maybe it's not even your own surgery. Lauren Debick has invited some guests here that can answer your questions, and the guests are Amanda Williams. She's the manager of outpatient services for Ocala Health. Jeff Nasman is the director of rehab services at Ocala Health, and Russ Harper is here, a surgical specialist at Ocala Health, and he works with community physicians and teams to make sure that physicians have what they need to create the best surgical experiences for patients. And the number to call right now is 622-9622. Lauren, before we do anything else, though, can you give a number they can call?
Absolutely. So Russ mentioned the consultant nurse number.
Yes.
If you are thinking about surgery, inquiring about surgery, or if you need to take the first step and find a primary care provider to refer you to someone, the number is 1-800-530-1188.
And we've used it ourselves. It's just scary when you call that number. It's like, oh my gosh, I'm so worried about something, right? And then they ask you questions. You go, oh, I don't know if I want to do that, right? So the comfort zone comes from the three of you, because you can kind of set us straight as to what it all will entail. Am I right about that?
I think comfort, yeah, I think so, and I think comfort comes from confidence, right?
And knowing that people can help you, right?
Right, yeah, and I'm confident in the people that we have at, Amanda and Jeff and the people at the hospital, our
Sure.
surgeons. That's what, to me, helps reduce that anxiety, is confidence in the people, and also I think that you trust the process and the path that you're on,
Are all of the procedures the same for minors as they are for non-minors? Because sometimes you need to treat the children differently. You still have to talk to them to have a conversation with them.
You do. I mean, and of course their parents are involved, and we give them all the information that we possibly can. But yes, I mean, try to be when it comes to children, you want to make sure that you talk to them in a way that they can understand.
And sometimes the parents are more nervous than the children, so you've got to
Yes.
be extra careful and calm the parents down so they don't make the children nervous.
Yep, that is part of what we do.
Do you,
Absolutely.
do you guys ever have to do damage control because we think we're educating ourselves with the internet and we maybe got some bad information? Do you ever have to do damage control and reteach us what we think we know?
Yeah, I think that happens occasionally, where you read something on the internet and you feel like it applies. But that's the purpose of going to a provider, is they're going to evaluate you and do an individual treatment plan. And sometimes you may have the same diagnosis as someone else, but it might be, general diagnosis, but might be a little bit different. So we tailor-make that plan to that individual, and so you might have to tweak some of those things. And you can't always believe everything that's on the internet.
Oh, I know. You should see what they say about radio hosts. Well, it's really always good information, and I love the fact that you do this and come in here and help our listeners understand what's going on and what could happen for them. Where do you see your fields going in the future? It's changed so much in the last few years. Do you see it changing? Amanda, do you feel like there'll be more and more outpatient procedures?
I believe so, yes. I mean, just the idea of talking about the hip going home, the same day.
Yeah.
You think
Right,
years ago, I would
yeah.
have never thought that would have happened. So, I mean, yes, I can see us moving in that direction.
Does stem cell surgery really exist? I mean, what is that? What is the truth about that?
I think there's some debate with the research. I mean,
So we're not sure yet, huh?
But no, I don't think we're sure yet. I think some people are using that and testing out based on what they've seen in some procedures, but I don't think there's a real definitive yet that we've seen.
And how will telemedicine affect what you all are doing for an outpatient? Is that a good thing, the telemedicine aspect?
I think it's a tool that people can certainly use as a resource. I don't think it's going to replace what we do in our respective areas. In physical, occupational, and speech therapy, I just see that getting busier and busier as the population ages. There's going to be an increased demand, and as more and more research comes out and says, exercise has a lot more benefits than we ever knew. So,
does the work you do, Jeff? Is it sometimes like getting the cart rolling and then we take it from there? Like we take what you teach us and then we continue it on a daily basis or for the rest of our lives?
Absolutely. I mean, education is a huge part of what we do, and we don't want to make people reliant upon us solely. We want to be a resource for them, educate them, and help them along the way. And that's why it used to be, say for example, in ACL surgery, we'd see people 3 times a week for 3 or 4 months, maybe 5 months. Now we might see them twice a week for 4 to 6 weeks, and then maybe once a week after that. So the frequency goes down as we educate and as the patient's able to.
What if I could squeeze one in real quickly? I was in an accident once, a car accident, and then I was going to a chiropractor who was providing therapy. And the insurance company said, well, we need to send our own to make sure you really need it. And long story short, I did. But the point was, and the question is, the insurance company wouldn't have continued to pay if their guy said I didn't need it anymore. And so I'm wondering, how do you measure it to, I guess, give evidence to the insurance people that you need to keep doing what you're doing?
Well, that's all part of the evaluation process. We do an evaluation with standardized tests, and we get those results, and we might see limitations, either functional limitations or physical limitations in terms of, like, say, range of motion or strength. And we document that in our evaluation, and then we write up a plan with goals on how to address those limitations. So that's all part of the process. That evaluation plan then goes to the insurance company, and they have their experts that will make a determination on whether they agree or disagree with the information. But
Right.
Our community sure is lucky to have Ocala Health here, because you guys are always such a great team, and you always are so open when people from the community have questions and need answers. You're upfront, you're truthful, and everybody knows what to expect.
Thank you.
Thank you.
Thank you for using the radio as a way to get the word out, too. Let me say thank you to everybody. Jeff Nassman, thank you. Thank
Thanks
you.
for
And I
having me.
apologize if I'm not using titles. I don't know how to read the initials. Jeff Nasman. Is it Dr. Jeff, do I say?
Doctor Physical Therapy, sure.
Doctor, okay. And Amanda, are you a doctor?
No, I'm a nurse.
Amanda Williams, Nurse Amanda. And Russ?
I am not.
Not a doctor, okay. Russ Harper, thank you. And of course, Lauren Debick. Oh my gosh. You see this? You see what's going on over here? It's another language. Thank you.
Thank you for having us.
We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sun will mix with clouds and we'll have a thunderstorm in the afternoon.